us about your experience of speaking about Apollo Pediatrics, gastroenterology, hepatology, liver transplantation and nutrition.
So this is a quite comprehensive teaching program which is designed mainly from the point of view of pediatric gastroenterologist, hepatologist, and what I spoke on in this conference is imaging in pediatric gastroenterology, and I mainly emphasized about the relevance of interaction between the radiologist and the clinicians, which is important because for a small child it is not possible to keep on doing imaging investigations. It is important to properly interact, to design a treatment plan, to design a management plan, and accordingly this test should be devised keeping with the exact clinical problem, and accordingly the test should be done. For example, for a CT scan, it should not be advised very casually. It should be only done when it is absolutely justified, depending upon the extent of the problem. So the purpose of this talk at this forum of teaching course is to educate the young pediatricians, pediatric gastroenterologists about the different imaging modalities, the different imaging options, and how to go about it, how to have the imaging algorithm in place to use in day-to-day practice.
How will this postgraduate course help doctors to improve their clinical practice?
In clinical practice, actually, the pediatricians, the pediatric gastroenterologists come across these patients very commonly where they are stuck with the clinical picture. So they have a particular list of differential diagnoses in their mind, but they need to confirm the diagnosis, and for where the role of imaging comes into picture. And but it is important for them to clearly understand the advantages and disadvantages of each of these imaging modalities, the radiation risk to their patients who are at a very young age and where the risk is more, and at the same time they need to understand the risk and safety of contrast media which are used in imaging studies. So they need to have these concepts very clear in mind, and whenever there is any doubt they should always talk to the radiologist rather than just advise the investigation. This will always ensure that the tests are done in a best possible way to give the maximum possible information.